Welcome back, our dear viewers. We're joined here in the studios of Hala Kuwait with our first guest for this evening, Dr. Ahmad Albasiri, resident in the Kuwaiti Board of Family Medicine. Of course, it's a pleasure to have you here, Doctor, with us in the studios of Hala Kuwait.
Thank you so much for having me.
It's our pleasure. Of course, nowadays, I think the weather is changing and there is a lot being affected by it. So what are the seasonal diseases, especially, that we might get nowadays?
Yeah. So when it comes to the seasonal conditions and the seasonal illnesses, as the weather is changing now and we're jumping toward the winter time, we're going to see a tick and an uprise in the respiratory illnesses. So we're talking about the common cold, the flu, and also an acute bronchitis as well as COVID as well, because it's going all over the world. So it's something that we're going to see in the next few months, and also some allergies that might come with time in the next few months.
Of course, we notice a lot of things that are changing because of the weather. As you mentioned, a lot of people usually getting allergies and a lot of diseases going on all around the world. Yeah. So when is the right time to go and visit the doctor?
Yeah, it's very crucial for people who experience severe symptoms, persistent symptoms, and symptoms that are a bit unusual. So I'm talking about chest pain if the patient is coughing up blood, for example, or if the patient has a very high fever. Then we advise people to go to their to the nearest medical center. Usually most of the symptoms for these common conditions are very mild and can be treated at home. With drinking plenty of fluids and like eating well, taking care of themselves. But if people have chest pain, they cannot breathe, or they have very high fever, then they have to go to the nearest medical center.
Of course, and we notice that a lot of patients sometimes when they go visit the doctor when they're sick, they usually ask for antibiotics. Sometimes they have a virus and it's not recommended for patients to get antibiotics. So when is the right time to actually be taking antibiotics?
Yeah, when it comes to antibiotics, it's a very crucial subject because there is a bit of confusion when it comes to it. So antibiotics are given when the body is fighting some kind of a bacteria. So the clinician, the doctor at the center or at the hospital are the ones that can make that decision. And as you said, it's viruses. The antibiotic will not work on viruses. It will only work on some strains of bacteria. So each antibiotic works on a certain bacteria. So I advise people not to start antibiotic by themselves and seek medical advice before starting anything.
Of course, and I think a lot of people, especially because the weather is changing, you usually get shots or vaccination because it's winter season, usually on the end of this November and the beginning of December. So what about the vaccination that you recommend for people to take, and why are they so important to take?
Vaccinations are a crucial point and are a crucial tool when it comes to fighting these common conditions and these illnesses. So we're talking about the flu vaccine, we're talking about the pneumococcal vaccine, as well as COVID vaccine that we've seen over the past few years. Because these vaccines can provide you with the immunity and the tool to steer away from the common conditions that we might face. But if you have these illnesses and if you contract them by any chance, then these vaccines will give you a fighting chance for these conditions to be very mild and not to require to go to the hospital or go to the medical center.
Of course, and even sometimes when you get typhoid disease, usually when you recover from it, like a week or 2 weeks after, you usually get it back. So this is something very common nowadays, and we'd like to know, how do we recover from such diseases?
Yeah, so the common symptoms that we might face, some people might experience fever, some might experience some stuffy nose or like some coughing as well. So these symptoms can be managed at home with drinking plenty of fluids, plenty of warm fluids, making sure that people eat healthy, that people keep moving as well. But these conditions, we might get them later on because the body might lose the immunity that it has, but there are also other strains of viruses that might cause the same condition. So some people might have that question in mind. But that's what happens.
Of course, you mentioned also eating healthy food. I think this is one of the most important ways to prevent getting diseases or any type of seasonal allergies. Sometimes they can really affect your lifestyle, your diet. So it can really lift your immune system. I think this is one of the most important things a lot of people usually neglect. And when it comes to the seasonal allergies, as we mentioned, how can someone avoid getting affected by it?
Yeah, so seasonal allergies are something that we always face every year. It's something that can happen to anyone. So the best way to try to avoid seasonal allergies as much as possible is to recognize when there are pollens in the air, especially now that we're moving toward the drier months, kind of. People have to realize when the pollens will be in the air or there might be dust in the air, so it's better to stay inside. If the person has to go outside, then we recommend wearing a mask so that they might not get the seasonal allergies. And once they get back home, I think it's very important to take off their clothes, go take a shower as soon as possible, so that you rinse away the dust and the pollens that might be on your body.
Of course. And what about the precautions when it comes to the change in the weather? Because you mentioned nowadays the change of the weather, this is one of the reasons that we're facing a lot of allergies and people usually go to the doctor with allergies because of the change of the weather. So how can we take the precautions that will prevent us from getting these allergies?
Right. So because of the change in weather and we're shifting toward the colder kind of months, so it's very important to dress appropriately. I think this is the most common cause of why people they can get the respiratory illnesses and allergies as well. So I think that will be the main part of protecting themselves from these conditions. But I also recommend people to keep washing their hands, to wear a mask whenever it is necessary for people to wear it, and maybe to stay away from people that might have some symptoms and that are showing some symptoms. And if you are someone who have these symptoms, it's better to avoid people who are the elderly and the children because they are the most affected by it.
Of course, and I think one should, a person, especially with allergies, there is a lot of different type of allergies and there's a lot of different reactions to it. So when should a person actually go to a hospital when they're facing an allergic reaction?
Yeah, I think that's a very, very, very important question because some of the allergic reactions that might happen, they tend to be very severe. So, and we call them the anaphylaxis shock, and this is something very serious and can be life-threatening. So those people that might experience it might experience a swelling in the face, a swelling in their lips and mouths. They will find it very difficult to breathe, and they might also get some rash around their face and their bodies. So it's important for the parents, for example, or even for the person themselves, to keep an EpiPen with them. So it's something that they can inject themselves with to help with these severe allergic reactions, and to go to the nearest medical facility as soon as possible. The other forms of allergies are very easy to manage, with taking tablets called antihistamines, and those tend to fix the person pretty quickly.
Oh, of course. I think this is a very important point for people with a serious allergic reaction to actually have an EpiPen around, and even let the people around them be aware of this kind of situation, what they're allergic to, and how to react in these kind of situation, as you mentioned. And of course, for our dear viewers who are watching right now, is there a word of advice you would like to share with them?
Yeah, I think being proactive when it comes to taking care of your health, I think it's something that is very, very paramount, and because we tend to use medications when we get sick, and maybe that's a bit too late. So if you take care of your body in terms of eating healthy, eating plenty of vegetables and fruits, as well as staying active and going outside and keeping yourself moisturized, So that will also protect you from seasonal allergies and like skin rashes and eczema for kids especially. So I guess my message is to live a healthy life, and that's hopefully will lead you to a better health in the future.
Thank you for that amazing advice, Dr. Ahmed, and it's really a pleasure to have you here in the series of Hala Kuwait.
Thank you so much for having me.
Thank you. Dear viewers, we had with us Dr. Ahmad Albasiri, resident in the Kuwaiti Board of Family Medicine. Let's move on to our next report. It's Charlie Chaplin. Stay tuned.